Dr. Nina Kramer.
And I'm Dr. Dennis Davis. So Dr. Kramer, what are some signs and symptoms that a patient can be looking out for that may give them a suggestion that they have periodontitis?
So like Dr. Davis mentioned, unfortunately, periodontitis doesn't hurt. A lot of times you won't even know you have it, but there are some things that you can be on the lookout for in your own mouth. And most of us aren't looking at our gums and our teeth that closely, but if you happen to notice bleeding gums or bad breath or loosening of your teeth, or perhaps your gums are receding, then it's time for you to come in for a periodontal evaluation. So Dr. Davis, can you show me on the model what periodontal disease would look like?
Yeah, what the dentist or hygienist is doing is they're taking this probe and they're gently going between your gum and your tooth. And in a healthy mouth, you're going to see that the bone level is properly right below the gums, and that probe just barely goes in. On a patient with advanced gum disease, you see that probe goes in even further, and you peel those gums back, and this is a model, and you see that the bone level is way down here. And all of this is brown stuff. It's called dead bacteria called tartar. In addition to this thorough periodontal examination, we supplement our examination with a thorough and high quality radiographs, and oftentimes now with technology, a CT scan. Unfortunately, periodontal disease and periodontitis is an asymptomatic disease, meaning that patients or the person isn't even exhibiting any signs or symptoms. They don't even realize that they have a problem. There are some other clinical conditions that make a patient more susceptible to periodontitis. We call those risk factors. Some of those risk factors are smoking, stress, genetics, certain medications, poor nutrition, and diabetes and heart disease. These medical conditions or lifestyles can predispose a person to periodontitis. So you're more likely to have periodontitis if you have some of these conditions, and you need to be on the lookout for that.
And the CDC estimates that 70% of people over the age of 65 actually have periodontitis, and a lot of these cases are undiagnosed. So it's important for you to take charge of your health and get evaluated to make sure you can get treatment before it's too late.
If you're concerned about periodontal disease because you have a risk factor, or you have some of these conditions that we already spoke about, one of the things you want to make sure you're doing are brushing your teeth properly. You want to supplement dental aids such as flossing, water picks, Proxa brushes, and you want to make sure you're seeing your dentist on a regular basis so that they can both detect the early signs of periodontal disease and help you better understand the disease process.
And in a lot of cases, twice a year is not enough for cleanings for a periodontal patient. They need to be seen with more frequency so we can stop the disease process and remove the bacteria that causes the disease.
Yeah, we get that question a lot. Is 2 cleanings a year necessary? Well, they've done a lot of studies and they've shown that after about 3 months, that bacteria that we discussed that's creeping down your gums starts to change, and that's when it becomes pathologic. And that's often why we periodontists suggest more frequent cleanings, and that 6-month recalls or 6-month cleanings are just not enough to keep the disease process at bay.
Thank you for watching our short video today. If you have any further questions, please contact our office at 352-259-6799.
Thanks again. Appreciate it.